Self-examination of your breast, how it is important and what is its purpose. So self-examination is a very important tool, it's a very useful tool, and it is a mixture of both physical and visual examination, which means that when we touch and feel our breast, that includes the physical component, and visual is what we see morphologically or on a top experience or a top visual of our breast, what we see clinically if there are any other changes. So it is a very important tool to look for the signs and symptoms for breast cancer. Now, what is the purpose? The purpose is that when you do a breast examination of your own every month, it is said that you are very familiar with the way your breast look. So once you are very familiar with how your breast appears to be to you on a daily life, if you see any changes in the future, you are easily able to detect it on your own. You see that it is an abnormality, and then it makes it easier for you to visit a doctor and tell them about the abnormality that you have seen. So it gives you a detailed information of how your breast looks like in normal life, and if you see any changes in the future, you are able to differentiate very easily. So it is very important. Now, although self-examination is very important, does it replace the normal mammography schedule for you every month, or does it replace the clinical evaluation by a doctor? It does not. Because yes, although it is a preventive measure that when you examine your breast by yourself, it gives you a surety, it gives you a sense of satisfaction that you understand how your breast generally appears to be, and if there is any abnormality, it helps you reach a doctor. But also, maybe there are some points that you miss which a doctor can see better. So a clinical evaluation is very much important as self-examination is important to you. Also, the scans that are prescribed, mammography plays a very important role. So apart from self-examination, which is a preventive measure, mammography also should be considered. So many of you ask us, how often should a breast examination be performed? In all adult women, we encourage them to evaluate your breast once a month. So it is very important, if you evaluate your breast once a month, you are aware of the whereabouts of your breast, you are aware of the appearance. So any change can be seen to you at the earliest before even you meet a doctor. So self-examination plays a very important role along with other diagnostic evaluation, but it should be considered and you should perform evaluation of your breast on your own once in a month, definitely.